مرحبا طلاب. محاضرتنا اليوم نبديها بشرح مختصر للchronic glomerulonephritis which is the final stage of many forms of glomerular diseases like in rapidly progressive glomerulonephritis and focal segmental glomerulosclerosis. It is characterized by progressive renal failure, uremia, and ultimately death if not treated. الكلينيكال فيتشرز هي نفسها of chronic kidney disease or uremia وتشمل الأنيميا, أنوركسيا, malaise, proteinuria, hypertension, etc. On pathological examination, grossly the kidneys are small and shrunken نتيجة لفقدانها وظيفتها فراح يصير بها atrophy. While microscopical examination shows hyalinization of the glomeruli, interstitial fibrosis, atrophy of the tubules and lymphocytic infiltration. طبعا التريتمنت يبقى البيشنت on chronic dialysis يبقى يغسل بالكلى and the other option هو renal transplantation if there is a donor. نجي للglomerular lesions secondary to systemic diseases يعني secondary glomerulonephritis. أول disease راح ناخذه هو SLE. SLE هو systemic disease البيشنت عندهم auto antibodies against double strand DNA. طبعا هو يأثر على organs مختلفة بس إن الموضوعنا الحالي هو effect of SLE on kidneys which is called lupus nephritis. طبعا اللوبس نفرايتس بيها classification إن شاء الله تاخذوها بالباطنية بالسنوات الجاية بإذن الله. بس هي clinical presentation أو clinical features include a wide variety of patterns. ممكن البيشنت يجي عنده hematuria either gross or microscopical, nephrotic nephritic range, hypertension or renal failure. الديزيز الثاني اللي راح ناخذه هو الأميلويدوسيس. الأميلويدوسيس it is also a systemic disease occurs when there is a precipitation of amyloid fibrils in various tissues من ضمنها الليفر, الكدنيز, الهارت, أماكن وأورجانز مختلفة. هاي الأميلويد fibrils هي abnormal aberrant misfolded proteins. بالحالات الاعتيادية لما يصير precipitation of proteins in tissues الجسم راح يقدر يتخلص منها عن طريق البروتيوليسيس. In case of amyloidosis the proteolytic enzymes cannot degrade these precipitation, so there will be a build up of the amyloid protein precipitate. فأكيد هذا راح يأثر على شكل الأورجن وعلى وظيفة الخلايا. In kidneys the amyloid will deposit in the glomeruli and in the vessel walls producing a heavy proteinuria, and eventually the patient will develop end-stage renal disease. Diabetic nephropathy leading to end-stage renal failure occurs in about 40% of type 1 and type 2 diabetes. Clinically, the first presentation of patient with diabetic nephropathy هو microalbuminuria, then it will progress to nephrotic syndrome. However, diabetes also cause hyalinizing arteriolar sclerosis, increased susceptibility to pyelonephritis وهذا متوقع لأن أكو decrease بالimmunity in patient with DM, and increased susceptibility to papillary necrosis. The morphological changes include يعني under the microscope راح أشوف capillary basement membrane thickening, diffuse sclerosis of the mesenterium, nodular glomerulosclerosis, which is called Camel-Steele-Wilson disease. هذا السلايد يوضح لنا الدايابيتيك نفروباثي. اللي تشوفون الجلوميرولاي بيها سكليروتيك نوديولز، يعني السكليروسيس متجمع على شكل نوديولز inside the glomerulus called Camel-Steele-Wilson syndrome or disease, which is characteristic for patient with diabetic nephropathy. Henoch-Schönlein purpura. It is a multisystem disease, usually affects children, but it also can affect the adults. It is a small vessel vasculitis. تصير usually following an upper respiratory tract infection. الجسم راح يكون antibodies against الباثوجين اللي يسوون الانفكشن, and these antibodies will cross react with the small blood vessels due to molecular mimicry. فايش راح يصير عنده vasculitis of small vessels. من أهم الأورجنز اللي تتأثر this disease number one هو السكين. فراح يصير hemorrhage into the skin, فراح يصير عند البيشنت petechial hemorrhage or purpuric skin lesion, usually in the extensor surfaces of the legs and in the buttock. Number two, affecting gastrointestinal tract. فالبيشنت راح يصير عندهم GI bleeding and intermittent abdominal pain. It also affects the joint, leading to arthritis and arthralgia. And our topic is renal involvement. In kidneys, these patients will develop gross or microscopical hematuria, nephritic syndrome, nephrotic syndrome, or a combination of those two. A small number of patients, mostly the adult, develop rapidly progressive glomerulonephritis with many crescents مثل ما شرحنا بالمحاضرة اللي فاتت. طبعا البيشنت احنا مثل ما نعرف البيشنت with vasculitis usually positive for ANCA anti-neutrophilic cytoplasmic antibodies. البيشنت اللي عندهم Henoch-Schönlein purpura ما راح يصير عندهم هذا elevation in this antibody. راح يصير عندهم elevation of IgA immunoglobulin. وطبعا هنا راح يصير هذا ال IgA يصير له deposition in the mesangium leading to glomerular injury. موضوع جديد هو ال systemic diseases of the kidney. Cystic diseases of the kidney are heterogeneous, comprising hereditary, developmental and acquired disorders. They are important. ليش؟ Number one لأنهم common. Number two, some of its form such as adult polycystic kidney disease are a major cause of chronic kidney disease. Number three, it can occasionally be confused with malignant tumors. سوينا classification للcystic disease إلى number one, adult polycystic kidney disease, which is usually an autosomal dominant inheritance. البيشنت اللي عندهم adult polycystic kidney disease usually have other abnormalities. أهمها هي بالإضافة إلى المulticystic kidney disease عندهم multiple cysts in the liver, عندهم berries and aneurysms of the circle of Willis. البرزنتيشن هو hematuria, flank pain, UTI, renal stones, hypertension. الoutcome or prognosis هو chronic renal failure beginning at age of 40 to 60 years. فإذا death, possible cause of death in these patients either chronic renal failure or مثل ما تتوقعون هو البريز انيوريزم يصير بيها رابتشر فيصير intracranial hemorrhage or subarachnoid hemorrhage leading to death. السيستيك ديزيز الثاني of the kidney هو childhood polycystic kidney disease, or it's called sometimes autosomal recessive polycystic kidney disease. And as the name implies, it is an autosomal recessive inheritance disease. The kidneys are enlarged and with multiple cysts, usually at birth, يعني presents at birth. Also associated with hepatic fibrosis. The outcome is variable, but usually death in the infancy or the childhood نتيجة renal failure. Number 3, medullary sponge kidney. And as the name implies, the cysts occupy the medullary part of the kidneys. Diagnosis by excretory urography. البرزنتيشن هي hematuria, UTI, recurrent renal stones, and it usually follows a benign course. Multicystic renal dysplasia. The kidneys are irregular with cysts of variable size, associated usually with other renal anomalies, يعني مثلا horseshoe kidney, double ureter. Outcome renal failure if bilateral, and it is surgically correctable if it is unilateral. آخر cystic disease راح ناخذه هو acquired renal cystic disease. Cystic degeneration in end stage kidney disease, يعني البيشنت اللي هم on chronic dialysis and end stage renal disease نتيجة الاتروفي و some of the atrophied tubules يصير بيها cystic dilatation، فراح يصير cyst formation، وهاي cyst مليانة fluid and serous fluid. الكومبليكيشن مالتها هو الهيموريج، erythrocytosis and neoplasia. البيشنت on chronic dialysis عندهم تقريبا 14 to 18 fold increment in the risk for developing renal cell carcinoma. وطبعا هو اصلا من البدايه البيشنت هو dependent on dialysis. ممكن الرينال ترانسبلانتيشن تفيدهم بهاي الحاله. بهذا السلايد نشوف kidneys of patient with adult polycystic kidney disease. مثل ما تشوفون grossly the kidneys are large in size. ممكن يصل حجم الكدني to 3 kilograms. outer surface is irregular. تقريبا ما باقي normal kidney tissue، كلها replaced by variable size cyst مليانة بسيرس fluid. مثل ما عرفنا البيشنت end up with chronic renal failure early in the adulthood. This slide shows autosomal recessive polycystic kidney disease or childhood polycystic kidney disease. The kidneys are large in size, but the outer surface is smooth لأن الcysts are small in size, numerous but small in size. مثل ما ذكرنا ال child or infant die from chronic renal failure. بهذا الجروس picture نشوف إنه الكورتكس normal spared, while the medullary part replaced by small numerous cystic spaces. الdiagnosis مثل ما قلنا of patient with medullary sponge kidneys is by intravenous urography. يعني أنا أنطي البيشنت أعطيه IV صبغة IV حتى يسوي لها uptake by the kidneys. البيشنت with medullary sponge kidneys راح ألقي أولا filling defect، ثانيا ألقي فتشي characteristic اسمه papillary blushing، يعني يصير مثل البوكيه مال الورد، البابيلي مال الكدنيز يصير مثل البوكيه مال الورد، بس سموها papillary blushing. هاي characteristic للpatient with medullary sponge kidney. Usually, as I mentioned, the medullary sponge kidney follows a benign course. Grossly, the multicystic renal dysplasia showing large cysts of variable size. بالالتراساوند إلها يعني في شي كاركترستيك يصحوا لها non communicating cysts، يعني السيست ما متصلة بالسيست المجاورة إلها، يصحوا لها non communicating cysts. Usually end up with renal failure if it is bilateral. If involve one kidneys فممكن يوخروها يبقى على الكدني الثانية أو يسوي transplantation. Thank you very much.